Well, hey, everybody, this is Robert, and welcome to Outbreak News Interviews. Now, my guest today writes, quote, in places around the world, malaria is closely linked to illegal gold mining. In a recent article in the BMC blog, BugBitten, that's entitled, A Story of Two Fevers When Malaria is the Price of Gold. So, what is malaria, and how is it linked to illegal gold mining? Well, joining me today to take a look at this huge public health problem in certain parts of the world is Karina Mondragon-Shem, PhD. Dr. Mondragon-Shem is a vector biologist who specializes in the ecoepidemiology and social impact of tropical diseases. Hi, Karina, and welcome to the show.
Hi, Robert. Thank you for having me.
You bet. So before we get into this world of illegal gold mining and the devastation that it causes, can you go ahead and give the audience a short review of malaria?
Sure. So malaria is a disease caused by Plasmodium parasites that are transmitted by female Anopheles mosquitoes. And the way that you get sick is that an infected mosquito bites you, the parasites enter your body, they travel to the liver, and there they replicate, then exit into the bloodstream. And it's actually this infection of the red blood cells that causes many of the signs and symptoms that we associate with malaria. So like fevers and chills. And so this goes on for a while, and eventually a small number of these parasites transform into a stage that is picked up by a different mosquito during another blood meal. And inside the mosquito, the parasite continues to develop until it's ready to be transmitted into a different person. And so when you are infected with this parasite, you have sort of three scenarios. You have uncomplicated malaria, where you go from periods of cold and shivering to fevers, headaches, vomiting, just general malaise. The doctor might also check for enlarged liver and spleen, for example, which are effects of this infection. You might also have severe malaria, where the parasites travel to your brain and cause all kinds of damage there. You can have severe anemia, respiratory distress, kidney injury, just to mention a few signs. And then a third scenario is where you have asymptomatic malaria. And so you're infected with a parasite, but you don't show any signs and symptoms. And malaria happens in tropical and subtropical regions around the world, especially in developing countries. But specifically, it happens wherever you have the right climate conditions for the mosquito to develop and for the parasite to develop inside the mosquito, so there can be transmission between people.
Yeah. Now, this is very important because there's something called illegal gold mining that probably a lot of people in the audience have never heard about. And I know in some of my interviews with talking to other people in South America that, like Venezuela, they have a lot of issues with malaria because of this. So, Karina, what is illegal gold mining? And other than Venezuela, where do we see this as a problem around the world?
Yeah, so the definition of illegal mining is determined by national laws and regulations. And so this can vary by country. But it's really important to understand that both legal and illegal mining use a lot of the same extraction techniques. And so beyond this classification, the environmental destruction, which is the real link here with disease, is a consequence of the methods being used to extract the gold. And so these can be common to both kinds of practices. So for instance, you have illegal mining that is closely linked to organized crime, violence, the displacement of local populations, and or that can take place in natural parks or reserves. And here you have a lot of malaria. You also have artisanal and small-scale mining operations which are considered more informal, but use many of the same practices, here you can also have malaria. And then you can have legal mining contracts where the company makes sure that people are enrolled in the national health system, or that they commit to repair the environmental damage left after they finished mining in a site. And the thing is that this is all on paper, so it might not even happen. And here, again, the same extraction techniques, you can also have malaria. It's just a matter of how controlled or uncontrolled it is.
But with legal gold mining, though, is it similar techniques, and would you still have the same problem with malaria?
Yeah, so it's the environmental destruction that is left behind, which can be more unregulated with illegal mining, but that can also happen in some types of legal mining.
Sure, sure. And what's the process they use that makes it conducive to malaria? What's the correlation between the two?
Yeah, so there might be many factors that connect mining and malaria, but the two that I mentioned in the article are first deforestation, and it's because these landscape changes increase the contact that humans have with the mosquitoes that transmit malaria, and so malaria increases. And then the other aspect is that we have to remember that Anopheles mosquitoes go through four life stages. You have the egg, the larva, and the pupa, from which the adult emerges. And these first three life stages are fully aquatic. And so when mining creates these wells or pits that then fill up with water, either from rainfall or from the same gold extraction process, you are creating essentially a lot of breeding sites for these mosquitoes. And so populations can explode. And this affects not only the people that are working in these sites, but also communities that might live close by.
Karina, who's doing this type of work? Is this linked to poverty also?
Yes, so in many places it is very closely linked to poverty, but mining communities can be composed of people from many different backgrounds. So you might have people desperate for work that don't have any other choice that to enter into this kind of work. You have people that might turn to mining because it offers a higher income that they're currently receiving because of different circumstances. But you also have people that have been so closely associated to mining communities their whole lives that it's just natural for them to gravitate towards this kind of work. And so this workforce is made up mostly by men, but you also have women, especially more recently. You can also have young people involved. And very commonly, you have a lot of migrant workers as a part of this. And another thing is that when the prices of gold increase, you have a lot more people rushing in to join this kind of work. And there is such a close association here that one study in Guyana was able to forecast malaria trends based on the rising prices of gold. And it shows how closely these two can be linked.
Now, in your article in BugBitten, you describe several different mining communities in countries in South America. Is the story basically the same, or is there differences between what's going on in Colombia versus Venezuela versus any other country?
Well, you will find similarities in that, again, the techniques that they're using can be common to these different mining sites, and then the consequences will be the same in the context of malaria. You find differences in the types of healthcare access that these people have, for instance. And so it becomes really important to understand for each mining community why and how malaria is affecting them. And so in the case of Venezuela, for example, it's a very interesting situation because Venezuela is a country that was declared malaria-free in 1961 through a lot of hard work with vector control and other things, and that now has, in recent years, been experiencing an alarming rise in the numbers of malaria cases and is currently the most affected country in South America. And I was watching a report the other day about Canaima National Park, which is located in the south of Venezuela, which is home to a lot of indigenous peoples and which is a UNESCO World Heritage Site. But a place that also in 2020 reported 59 illegal mining clusters, and each cluster has about a dozen mines. And so it's a really bad current issue. However, according to the WHO's World Malaria Report published in 2021, malaria in the region seems to be decreasing, and this includes Venezuela. But it's because of the restriction of movement during the pandemic, and because there's been a shortage of fuel that has affected the mining communities as well. And so it's almost another piece of evidence showing how linked these two things are. The other problem here is that even though this restriction has resulted in less malaria, it's also resulted in less access to healthcare, which is a big problem.
Yeah, and during that answer, you did bring up a couple of issues I did want to ask you about. So let me go ahead and piggyback on what you said. Do these miners receive any appropriate treatment? How does that work in those areas?
So in some places, they might be enrolled in the national health system, where they might have access to proper diagnosis and treatment, but it's not always guaranteed. In other places, there are no healthcare providers, or the centers that they have available don't have the supplies needed to diagnose and treat malaria. And so in some mining communities, for example, in Suriname, miners have resorted to self-medicating. And so they try to get the drug wherever they can. They start taking the medication, but they stop as soon as they feel better. And here the problem is that they might still have parasites inside, and this can lead to the development of drug resistance.
Sure.
And because mining populations can be so mobile, they might be transporting these parasites from one side to another and distributing drug resistance in the region. And so it becomes really important to understand health-seeking behaviors in these kinds of communities as well.
Yeah, and that was the other thing I wanted to piggyback on was the fact that these miners will go from one location to the other,
Mm-hmm.
bringing either the original parasite with them or a drug-resistant one, based on what you just told me. I mean, this is a big problem, right? This is one of the major problems.
And it's also influenced by the fact that a lot of mining clusters are located along the borders. And so this also increases or incentivizes the crossing of miners between countries. And this is a problem that has been reported in Colombia, in Guyana, in Brazil, and in Venezuela, as well as other places.
Yeah. Karina, malaria is not the only health issue that the miners face from this type of work. What else do they deal with?
They deal with so many health issues, and it depends on where the mining work is being done. Whether it's overground or underground, whether the chemicals they're using, how they're using them. Even things like their schedule of work can be affecting what diseases they get, because if they're working very late in the evening or very early in the morning, you can have vectors or mosquitoes or insects that are more active at certain times of the day, so people are more susceptible to this. And so the most frequent affliction that miners face is respiratory diseases, because they're constantly inhaling a lot of dust. They have malaria, mercury poisoning, because a lot of sites still use mercury. Parasitic diseases, apart from malaria, hookworm, for example, used to be really common in mining communities. And it actually used to be known as a miner's anemia or miner's itch. And more recently, cutaneous leishmaniasis has been reported in French Guiana, very closely linked to mining communities, because they're working in areas where they get bitten by sandflies, which are the vectors for leishmaniasis. And of course, now you have COVID, but we have already talked about like the multiple effects COVID can have in these communities. And one thing I would like to add here is that because people know these diseases are associated to mining communities, miners face a lot of stigma when they travel or when they return to their hometown. And this can be detrimental because it might discourage a lot of them from seeking medical attention that they need.
Why is there stigma?
It's just people know that if people assume that if you work in the mines, you might carry certain diseases. There's in a lot of communities, they know that people that work in the mines are carrying malaria. And so if something happens in their hometown, that might be the first person they blame. And it doesn't really help with the situation.
Sure, sure. Anyway, this is the article, A Story of Two Fevers, When Malaria is the Price of Gold, by Dr. Karina Mondragon-Shem. You can find that at BugBitten, and I'll link to it in the show notes when I publish the podcast. And Karina, any final thoughts on this story of two fevers?
Yeah, well, this is the link between mining and malaria is not new by any means. It's been going on for a while, and it's still a problem in many countries around the world. And in some places, it's the main source of malaria cases. And so it's important to facilitate healthcare access. I've emphasized on this a lot. To help people through the resolution not only of a malaria infection, but through any other conditions that they may be suffering from. Important to help reach mobile populations, which can be really hard to do. And in general, it's something that malaria control and elimination programs need to keep in mind, because it poses a big challenge for these programs.
Well, I want to thank you, Dr. Karina Mondragon-Shem, for sharing your time and expertise today, ma'am.
Thank you
Appreciate
for
it very
having me,
much.
Robert.